Hello friends, in today's class we will discuss low vision aids, right? So it was discussed in our previous class regarding retinitis pigmentosa and the management we had felt. So here we will discuss what are they. So in this class we will discuss the types of visual fiction dysfunction categories, the principles of low vision aids, indications and their examples. So coming to what is the definition of low vision. By WHO ICD-10, low vision is the person who suffers visual acuity between 6 by 18 to 3 by 60. Okay, in the better eye. After best possible correction or the visual field between 20 to 30 degrees. So this is the definition. Coming to the categories of visual dysfunction, we have visual disorder, visual impairment, disability, and handicap. So visual disorder is deviation from normal visual structure because of disease, injury, or anomaly. So it is deviation from normal function. Impairment is reduction of visual function which is resulting from this disorder. So this is impairment of vision, right? That is visual function. Then we have disability. So it is the reduced ability to perform a task. So here it is reading. And in handicap, it is the non-performance of the task related to the individual and social expectation because of this disability. So this is non-performance and not able to keep up to the social expectation. So these are the categories. Now coming to the WHO category. So WHO has divided into category 1, 2, 3, 4 and 5. So in grade 1 we have visual acuity, WHO type of blindness, okay, so grade, so normally 6 by 6, 6 by 18. So grade 1 is less than 6 by 18 to 6 by 60. So this is impairment. So in grade 2 is less than 6 by 60 to 3 by 60. This is severe impairment, when we have less than 3/60 to 1/60, this is blindness. Less than 1/60 to PL is also blindness, and no PL is also blindness. So these are the WHO categories. So this impairment and severe impairment, they come under low vision, whereas these three come under blindness. So according to, if we classify it based on the NPCB criteria, we can say this is low vision. Grade 1 is low vision. Grade 2 is economic blindness. Category 3 is social blindness. 4 is manifest blindness. And 5 is absolute blindness. Okay, so now coming to what are low vision aids. So low vision aids are the devices that improve or enhance the residual vision. Okay, so these improve, the devices which improve or enhance the residual vision by magnifying the image at the level of retina. So its principle is based on magnification or angular magnification. So because of this angular magnification, the normal retina which is surrounding the damaged retina can be used for the vision. Okay, so this magnification can be either relative size magnification or relative distance magnification. So relative size magnification is increasing the size of object, and relative distance is reducing the distance from the eye. Coming to the indications. So indications in children, in young adults, and old age. So in children, what do we have? Is albinism, ROP, any congenital malformation, optic atrophy or neuropathy. In young adults, we have keratoconus, ocular injuries, RP, and late manifestations of congenital. And in old age, we have glaucoma, ARMD, diabetic maculopathy, macular degeneration, and retinal degenerations. So here we also have this myopic or pathological myopia, like that. So these are the indications. Now coming to the types of low vision aids. So we will try to form a mind map of this. so that we can easily remember. Okay, so coming to the types, we have optical and non-optical. Okay, so this is non-optical and this is optical. So these are the types. So in optical we have magnifying spectacles, handheld magnifiers, stand magnifiers, telescopes, intraocular low vision aids. So what are these magnifying spectacles? So these are spectacles which are used. So these, they have high plus power, that is convex lens. So the advantage with is that it has more field of vision, and the disadvantage is that, and it can be used for both binocular or monocular conditions. The disadvantage is that they have aberrations with these spectacles because of high power, and it is suited for um, because of high power, the reading distance is near, which is causing fatigue and postural changes. And we also have, okay, so this can be used for both near plus intermediate visions. Now coming to handheld magnifiers, so here when there is a very less vision left, that is less than 10 degrees of visual field is left, so we have plus 4 to plus 40 diopters of power. We have aspheric or biaspheric or aplantic lenses. These are, so the advantage, so here this is only for near vision. So here the disadvantage is that there is less field of vision. Coming to stand magnifiers, these are also for near vision. In this stand, the magnifying device is placed over a stand, so it is at a fixed distance. The source of reading should be at a fixed distance, so that is its disadvantage. So usually it can be used for reading material. Okay, so coming to telescopes, these are for distance vision. So we have two types of telescope, as you know, Galilean telescope as well as Kepler's astronomical telescope. So here the optical principle of telescope is, it consists of two lenses, one is plus lens and one is minus lens. It causes a virtual erect magnified image. Okay, so it is the disadvantage is that, So there is less field of vision and the depth perception is not there. Then we have intraocular low vision aids. So these are the aids which are implanted inside the eye. So this provide the magnification. So here we have miniature telescopes. That is implantable miniature telescope. So these are surgically implanted into the eye. So these are help to see the distant objects. Then we have intraocular lens systems which have example IMAX, mono, and we have macular lenses like chariot macular lens. So this is implanted to magnify parts of the damaged fovea. Okay, so these are intraocular low vision aids. Then coming to non-optical devices, we have approach magnification. So in approach magnification, what is done? We come closer, the patient comes closer to the source. We have to adjust the light adjustment, contrast, sensitivity, adjustment. We have to increase the size adjustment. So in increasing size adjustment, we can use large print materials, clocks, devices, etc. Okay. Then we have electronic devices like CCTV, low vision imaging system, and VMAX. We have writing and communication. So in this we can use writing guides and other braille devices. Which can write on audio command and communicate on audio command. Then we have orientation and mobility devices. We have this walking sticks, cane, support cane, etc. And we have auditory or sensory substitutes. I'll mention it here. There can be auditory substitute or tactile substitute. In auditory, we can use talking books, screen readers, and in tactile substitute we have braille language. So these are our low vision aids. So here we have this mind map of the types of low vision aids. So this is a very important question. We most of the times forget to remember what is there and all. Okay, so just to add a little more to this, so light adjustment and illumination in these cases, reduced illumination is required in cases of albinism and aniridia, whereas higher illumination is required in macular degeneration, glaucoma, retinitis pigmentosa and all cases. Okay, then what else is there? Yes, so we have to remember this chart. This is very much important because this is the most commonly asked question. Okay, I hope this helps you to remember this topic better, because this is a very commonly asked topic. Okay, so we have magnifying spectacles, handheld magnifiers, stand magnifiers, telescopes, and intraocular low vision aids. Whereas in non-optical we have approach magnification, light adjustment, contrast adjustment, increasing the size, electronic devices, writing devices, orientation devices, and sensory substitute. So these are the types of low vision aids which we can provide to the patients. Thank you.